Hello, welcome to another one of our videos, and today we're going to be talking about ITB friction syndrome and the causes behind it. Not so much the corrective exercises, but what actually the factors that lead into creating it in the first place, so that you can eliminate that from being a problem. So firstly, what is the ITB friction syndrome? Well, the iliotibial band, which is on the outside of the leg here, is it's often called an overuse injury, and it's very common to the runners, hence it's nicknamed runner's knee, but also with cycling, and also could be just people who don't do running and cycling, just who have poor biomechanics and poor movement strategies. But basically it causes pain and tenderness on the outside of the knee, or just above on the outside here, and like I said, it's very common to the runners because there's such a repetitive action. So here's the anatomy of what it looks like, so you can sort of see where the muscle runs. It's like as the name suggests, it's like a thick band. It sort of starts at the pelvis and sort of comes from where the glutes are and runs down the outside of the leg and attaches to the shin bone just on the other side of the knee. So the TFL was the tensor fascia latae muscle, which is one of your main hip flexors. This one is a key amongst all of this because it's sort of one of the ones that's causing this to become short and tight and overactive in the first place, as are the glutes, who are sort of prone to weakness. So these guys up here are really playing a big role in the cause of this problem. All right, so we'll expand on that later on, but basically that's where the anatomy of it is and how it sort of runs, and its main role is to sort of abduct the hip and sort of stabilize the knee through flexion and extension. So abduction of the hip is like in a clam exercise, where we see the knee being, like the hip being moved away from the body, so away from the midline, and we'd see on a lateral lunge. But that's also happening when you're in a stance phase of walking and running, where that hip has to externally rotate to create the perfect alignment for the leg here. All right, if it doesn't do that, you roll in, and that's where we will often see patellofemoral problems in the inside of the knee. So this one's on the outside of the knee. It's probably more associated with the bowing of the leg, and almost like you could see here. And basically it's playing a role in that abduction, like we've said here, but it's also helping in extension and flexion of the knee. So flexion is in the squat here, and extension when it's extending out behind you, say in a lunge. But to squat down and then stand up is both flexion and extension. All right, so what causes the friction? Well, when the knees flex and the IT bands, where it's located is very close to like a little bony outcropping on the outside of the femur, which is basically your thigh bone. And when the IT band moves, when you're sort of moving into knee flexion and extension, it's sort of sliding across, forward and backward across this little bony outcropping called a condyle. And amongst that, there's a little sac or a bursa that allows it to sort of glide really smoothly. Now, when there's poor alignment of the hip and the way that you're moving, this band doesn't glide so smoothly, and it starts to rub against that bony outcropping. This increased rubbing, if it gets with lots of repetition or it starts to increase in force, starts to cause pain, and that's where you feel it on the outside of part of the knee, and hence its name, ITB friction syndrome. All right, so now, what do you do the very first thing you must do to try and get eliminated is find the trigger behind it. So, because what most people end up doing is just treating the symptoms, and that's what we'll see with using foam rolling to try and get rid of, or massage, acupuncture, or all these different things to try and release the ITB, but it's never going to work because the whole mechanism behind the problem in the first place is still at large, and you haven't changed it. So you've got to actually recognise what that is, and then avoid what's inflaming it. Only until you can do that can you start to then correct things in the long term, so that they don't come back. So you've got to, this is what I've sort of put it here on the slide, understand what your pain trigger is, and that's how you get rid of it for good. Corrective exercise is little chance of working if you fail to do this. The hard part is knowing where to look. So what could be the trigger, and you'll find that it's actually not usually just one thing, but it's like several, and the more repetitive things are, that's where you're going to be looking for the problem, because remember, it's a friction thing created from repetition, so it's not a one-off, like a one-off thing like an ACL tear might have been from which obviously is also from repetitive poor movement, but it could be just a single movement that does it. This is like a combination of thousands of. All right, so common causes. So like I said, not just limited to one thing, but many. So the stress may be the result of things like poor training habits, poor flexibility, very likely to be hip and pelvic weakness, very likely to be foot weakness, and the big one probably overriding all of them is neuromuscular coordination. So that'd be like how your brain coordinates moving. So that's a big one, because you may see all of these are fine, but it's the way you do everything that's not. The fact that it happens the most in cyclists and runners says a lot about this sort of training style and training habit and techniques. So the first thing is we'll start there to try and find what are the problems. So the first one is a bit of a no-brainer. It's just never wise to run in pain. So a lot of runners will try to run through their pain, almost like it's a badge of honour, but all it's going to do is just create compensation and problems. So it may not be pain at the knee at first, might have been at the ankle in running with stiff ankle or say a stiff hip. Running with pain causes compensation. That compensation changes things and creates new things. And this is often where we will see these little problems that in the beginning that could have been corrected become big problems that are now going to take a long time to change. One other thing we see a lot is running too many hills. So you can see here on this picture, hill running's great, but if you do too much of it, and especially if you have bad technique, that's a perfect recipe for problems. So because of the angle and it creates a huge amount of knee flexion, it's hard to actually stay stiff and tall when you're running up, especially steep hills like this one. Doing too much of it, especially the downhill, where the quads and that have to really work hard to stabilise your knee, otherwise your femur will slide right over your shin. So these guys going at a huge contraction on downhill running, so that's a big factor to consider. Running laps on an oval, always in the same direction, or even on a track or a road where there's a cambered banking, where the bank of the road sort of forcing one leg to be longer than the other. That starts to create these problems that we see here with this imbalance, because one side's, this side's on the low slope of the road, or vice versa, and that's where we start to see that TFL becoming a problem, in the weak glute thing that we spoke about earlier. Poor footwear that could create excessive pronation or even tight feet. So pronated feet are going to create lazy, weak, sloppy feet, that stiff ankles and all sorts of problems, as are the hollow foot. All right, so where there's no spring, where they don't have enough cushioning to absorb impact. So both of these, and the shoes that people wear, so we might see bunions. Bunions are a giveaway of problems going to be coming further up the chain, because you just can't come through the big toe properly. And lastly, poor running technique, and this is where we see people almost like running along a line, like on a tightrope. Last thing would be training volume, so progressing too quickly through distance, especially distance runners, so really ramping up their distances too fast. Now if I come back to this crossing the midline one, this is where I want to show you a picture here. So picture A sort of shows like a good alignment strategy where the person's got their feet optimally in position to absorb force and the ground reaction, force that's coming up through the, because basically your whole body weight's on this stance leg when you're running. So if it's coming straight up through the pelvis into the spine, you're going to absorb shock well. However, if the foot's placed further underneath you, you can see it's not going to be absorbed very well. And you remember this ITB sort of coming through here? Can you see how much stretch this would be under now? Whereas here it's sort of quite optimally aligned. Through here it's going to actually have a huge rubbing force. And that's where I see this all the time with people with ITB friction, this type of running strategy where if you videoed them, it looks like they are running on a dead line, as opposed to just sort of almost not quite train tracks, but running a bit more neutral. So you don't get excessive pronation with the feet, you don't get excessive internal rotation of the hips, so because the hip's going to have to abduct further, so those glutes are going to have to work harder, and if they don't do the job, ITB has no choice but to do all of it itself. All right, so this is a real big part to really get clear on if you ask a person with this problem. Cycling, if we have a quick look at cycling, so bike setup is a big thing here. Usually with the cyclists, I'm sort of suspecting if they're toeing in, so maybe they haven't got their cleats set up correctly. Maybe they're a person who walks toe in and they've set up their shoes the same way. and this is going to be a real big problem, because it's going to force the foot to internally rotate, and we're going to see the same thing that we saw with the running, and it's sort of the basically effect of creating bow legs, and that just basically increasing the angle, just like we saw on this last one. It just creating huge steep angles, and you'll see the same thing with a bike if the foot's turning in too much. So really adjusting your cleats to be in the right position is going to be a huge thing. And again, looking at your training volume, also seat height, but most people I think have got that right. It's just probably they don't pay attention to the shoes and their pedaling technique. Training volume, like I mentioned before with the runners, excessive hill climbing can be enough to overload and cause pain. If you say you're not a runner or a cyclist, and you've still got it, could be the next thing you want to look is how you move. And if you're a gym goer, definitely want to look at how you move. So especially with the squats, lunges, single leg things. So poor forms, and here's poor form here of both of these. So poor position on a squat. This is very quad dominating, very poor hip movement. This one could be poor foot, could be poor hip, could be called poor brain. But basically that's a poor alignment. This one's going to be probably more patellofemoral. With the ITB we might see it sort of bowing out a bit more, but either way it's going to be a knee problem. This one's probably going to be more of a hip and back problem. But these are things you need to look at, and you need to evaluate them and assess them and change them if they're faulty. If you don't do it, there's always going to be cheating around it, and you're going to have problems. So what can you do about it if you've got it? Well, foam rolling, this is probably the thing that most people rely on the most, and it may help in some degree, but really don't hold my hat on this very much. I don't think it's the end game. I think it's maybe just a small stepping stone for some people. Stretching, as you would see here, these stretches are quite useless. If anything, they're probably more damaging to the hip by doing this. So I tend to avoid these stretches. They don't work anyway. And they're both cases, they're sort of ignoring really what the underlying cause of the problem is, and it's always weakness and poor coordination, poor stability. All right, so these things are just going to release a stiffness that's there to protect you. That's why it's there. It's not there because of bad luck. It's there because it's trying to do something that someone else is not. So really you need to work on those. So the TFL muscle, which we mentioned earlier, which is one of your hip flexor muscles, that'll be one of the ones that we'd want to try and mobilise, because this one's often left unchecked and creates an anterior pull of the ITB over the condyle, which results in the more friction. So releasing this is crucial. So to getting good hip function, not even for your lower back, getting this guy to work correctly is key. And there's several ways we can do that. I'll give you more ideas. Check the description under the video, because there's links with descriptions of how to do several ways of releasing this to see more. This picture here of one of our trainers sort of showing poor form, saying a lunge and a single leg squat. Most people would conclude it's weak glutes, but it's really difficult to sort of label it as one muscle, because it could be a series of things, and it may not be the glutes' fault. It may definitely be becoming weak, but it might not be. It might have been a reaction to something else. So is it a problem at the foot of the ankle and not a weak glute, or is the problem the fact that you didn't know how to move well, or is it all of these things? They're the things that you need to sort of have an assessment to really work out, to know where to start. So because muscle weakness could be the result of the muscle inhibition. So like we saw with the TFL, if that's sort of overworking, it's going to switch off things like the glutes. If the feet aren't working, they're going to be recruiting the ankles to stiffen up, to become a stiff joint to protect other things, but that's sort of going to change the roles of other joints as well. So you can see how it's really impossible to conclude that it's one muscle. So in the case here, like if we were saying someone did have weak glutes, let's say they demonstrated perfect strength in a simple exercise of a clam or a hip extension, how can the glute go from being strong in one and now you're saying it's weak on another? So it's not really the muscle, it's the pattern of movement, it's the motor program, and that's the things you want to change. So it's something you need to keep in mind when you're trying to work out what to do. So the tonic and phasic muscles, which I'll put here, so the TFL and ITB are known as the tonic ones, where they tend to, when there's a problem, they tend to overwork to protect you. And on the flip side of that, there's the phasic ones which shut down, and being the glutes, for example. VMO is another one. So and they tend to sort of switch off entirely and creating more problems and turning the other ones up again. So basically what happens is the ITB, TFL are going to steal the work from the other ones. So this is where we might see the clam being done, which is a good glute exercise, but the ITB trying to take over and do it. So all you're doing is using an exercise to make the ITB even more facilitated. So to stop that from happening is where we might use foam rolling first and then transition into the glute exercise straight away, like immediately after it. If I just do the foam rolling, I don't get anywhere. If I try to do this without the foam rolling, I don't get anywhere. I sort of need the two to work together and in this order for it to work. All right. The neuromuscular control, which was saying the brain, this is where we may not see any problem with the muscles at all. They're perfectly fine when they're on their own. It's just how they interact with each other. So this is why a lot of beginners are really weak in the beginning, because it's not so much about their muscles, it's just their coordination so often. Their timing and their positioning of joints is the problem. And they never have a chance to get stronger because everything's in the wrong place and it works at the wrong timing. All right, so this is where you might be all you need to do is learn how to move better, and everything will reset itself to the way it was. So protective mechanisms, so like we're saying, body's pretty smart, it can anticipate the pain before you move, so it can change motor programs in the blink of an eye. If it sort of senses something's not right, it's going to come up with a different one to protect a joint that's exposed to a problem. So this is where you have to really have a keen eye for looking at these different things in movements. So the movement that hurts you is the one that you sort of need to observe and change and work out what's going on, and understand that a muscle might become weak because there's something else trying to protect the joint, right? And that's what you might have to work on for a while. Sometimes there's too much mobility, so we've looked at a lot of stiffness of things. Well, then on the flip side of that is when someone doesn't have enough. So if that person's always overstretching, the ITB is going to be forced to react to this, because sensing the hip joint's not stable enough, so it's going to tighten everything up. So no stretching or foam rolling is going to make any difference here. So the only way to get rid of the stiffness is to learn how to stabilise. You actually need to stiffen up to loosen up in a way. So creative techniques, so you can sort of see here where we're using different little things like to encourage more stability within a movement where they may be a bit sloppy, and it just takes a bit of trial and error to find the right ones, but it's definitely a factor to consider, and I see this quite a lot of people, also females who do a lot of yoga and that as well. And they go running and then they wonder why they get pain, because they're just not stable enough. They need to actually strengthen up a bit and stop the mobilising so much. So I mentioned a few times already, the assessment's a critical thing, because there's no way I could tell you exactly what to do, because everyone's a bit different. So you have to use a series of tests to know where to start, and this is so big for ACL knee injury, but a lot of the tests I use in this I use with all knee things that just might branch out into different things depending on the person. So the main thing I understand is that you just need to have a series of things and a checklist to work through, and if you do that, then you'll be able to narrow where the leak is coming from and work out what's compensating, and find the underlying problem to the underlying cause of your problem. So the training volume side of things, you must understand that you can't train too often. So again, distance runners running too often, that could be maybe they move well, but they're just not allowing enough recovery. So I've covered this many times in other videos, and check in the description under the video for links on more detail on this. But basically understand, the harder you train, the harder you must rest. So if you're training really hard here, you need to allow good recovery, and you can sort of see you're only coming back to your top around about the end of day 3 and into day 4 after you've worked out. So it's like 2 days of recovery before you train hard again. So if you're doing intervals every day and weights in between as well, inevitably you're going to just develop little niggles that become big things. So finding the right balance. So common mistake with beginners, they don't probably train enough or train hard enough, so they don't really have developing the strength that they need, especially when they're trying to work through pain. The gym junkie trains way too often, does too much. You can see the pain thresholds crossing too often, so they get also no improvement in pain. The person who finds the right amount will start to get that gradual increase in improvement, and things get back to the way they were. So that's something that even if you're not in pain, you sort of always keep this in mind, finding a balance. Last thing I'll touch on is hydration. So it's something that was also overlooked. If you're a person that doesn't drink enough water, there could be a factor that may be leading to the tightening of the ITB. You know, it's maybe not the only thing, but it could be something that to keep in mind. Just bear in mind the muscle's pretty much entirely made of water, so it relies on it for its elasticity. So if you're dehydrated, it sort of shrivels itself up in a way and acts like a short and tight muscle, not because there's anything wrong with it, just because it doesn't have enough water. So that's something maybe to bear in mind, and it could be something that might help you. So summary: find your trigger, begin to identify it and change it. Look at your running technique, your bike setup, gym movement. Must rest and avoid the activity that aggravates your problem in the beginning. Use assessments to find where your hidden weakness or dysfunction is. Stretching is useless. Foam rolling may be useful, but it'll only work if you apply the corrective stabilising and strength work immediately after it. Carefully look at how much your training volume you have and evaluate if you're increasing too fast and not allowing enough recovery, and and consider water as a factor. If you do those things, you should get on top of it pretty quickly. For more information, because for the sake of the video going for 2 hours, more of the specific exercises I may use, they're all covered in our reports and videos that you can get. Again, check under the video here the descriptions for that, because there obviously is a ton of information about how to do that, and I just really wanted to use this video to cover the causes behind it and training considerations that you may need to address. But in terms of specific corrective exercises, all of this is covered in here step by step, and you'll find exactly what you need in all that. Alright, so I hope this video helps you out, and we'll see you on the next one.